Hi, welcome.
Thank you.
Thank you for your presentation. Could you give us a brief summary of your main message from your talk?
Sure. Well, as I alluded to earlier on, I suppose, traditionally when we've thought about psychiatric disorders and what goes wrong and how we can treat them, we've really focused almost exclusively on what goes on above the neck in the brain. But what our research suggests is that we should also think about what's going on below the neck, because as it turns out, the gut microbes, that's the microorganisms which are resident in your gastrointestinal tract, may have a very important role to play in our expression of symptoms and behaviours that are relevant to psychiatric disorders. And that includes a range of different things, fundamental components like how we react to stress, and brain functions like neurotransmission. So the neurotransmitters, for example, that are very important for as therapeutic targets of antidepressants may be influenced as well by our gut microbes.
Okay, thank you. How will this impact on care for patients with brain diseases?
Sure. Well, I think we should probably emphasize that it's somewhat early days yet, and that a lot of the studies that have been done are in preclinical studies. So we're really trying to see now whether that very promising body of research can be moved from the bench to the bedside. And there are a number of different ways, I think, in which we could envisage that might be useful for patients with psychiatric disorders. So, for example, very often standard treatments used, like antidepressants, may not work for everybody, and they may need a little help to get over the line. So maybe we could add in a psychobiotic, that is either a probiotic with a mental health benefit, a good bacteria, or something that promotes the growth of a good bacteria, to try and help the antidepressant get over the line for the patient who's suffering from depression. Or maybe another context that we could think of would be in the side effects that are associated with the treatments of psychiatric disorders. So, for example, one of the common side effects associated with antipsychotic treatment would be the induction of weight gain following olanzapine treatment, for example. Now, our research suggests that the antipsychotics may have an impact on our gut microbes, which is actually producing this weight gain. So maybe we could target the gut microbes with things like prebiotics or probiotics to try and control the side effects that are associated with commonly used drugs in psychiatry.
Thank you very much.
Yeah, thank you.